This program is designed to provide you information on the skills and techniques you'll need to save a life. Hands-on training is the most important step to learning, but this program will help you remember and learn the basics. You may have heard in the news that CPR was changed to a compression-only procedure. Unfortunately, this is not totally accurate. Based on research and technology, the national standard recommendation for CPR is to include breaths with the compressions. The recommendation is if a lone rescuer is untrained or a person is unwilling or unable to perform rescue breaths, then performing CPR compressions is preferred rather than no CPR at all. Of course, CPR is more effective with both chest compressions and breaths. This program will review adult, child, infant CPR, and obstructed airway. Additionally, we will introduce you to the AED, which stands for Automated External Defibrillator. Upon completion of this CPR video and participating in a CPR class, you will have learned the key guidelines essential for saving a life. When a person becomes suddenly ill or injured, there is a critical period before emergency medical service arrives, and you are that crucial link for the survival of the patient. Your immediate decisions and actions can make the difference on whether a person lives or dies. CPR stands for Cardiopulmonary Resuscitation. Cardio refers to the heart, pulmonary are the lungs, and resuscitation means to restore life. If a person's heart should stop or fibrillate, irreversible brain damage may occur within 4 to 6 minutes due to the inability of the oxygenated blood to reach the brain. By performing high-quality CPR immediately, you'll be able to circulate oxygenated blood to the brain and heart. To begin, there are certain steps that need to happen immediately to increase a patient's survival. Early recognition that there is a problem. Activate 911 or your emergency medical services immediately. Immediate CPR. Early defibrillation. Prompt advanced life support. Early CPR. Early CPR is the best treatment for cardiac arrest until EMS and an AED arrive. The steps of CPR are: scene safety, establish unresponsiveness, activate 911 and get the AED, check for breathing, start the CABs of CPR. Next, let's discuss each step individually. Check for scene safety. Scene safety is your number one priority when approaching a situation. Take a look at the environment as you approach to make sure you and others will be safe. You do not want to be injured or killed while helping someone in need. Look for hazards such as electrical situations, gases, traffic, falling objects, or any other potential problem. Sometimes the best thing you can do is nothing at all. You might also have to warn others to stand clear so they don't become part of the problem. Establish unresponsiveness. Gently tap and shout, "Are you okay? Are you okay?" You're trying to see if the patient responds. If the patient is unresponsive, activate 911 and get the AED. The quicker we call 911, the greater the survival rate of the patient. When telling someone to call 911 and get the AED, make sure you look them in the eyes and point at them so they know you are telling them to make the call. If you're alone with an adult patient, you will need to call 911 first. You can then obtain the AED if available and return to the patient. Next, you will check breathing. Observe patient by looking for breathing or movement. Do this for a minimum of 5 seconds. If it appears the patient has an occasional gasp or snore, this may be agonal respirations. This should be treated as not breathing. If the patient is breathing, then their heart is working and no CPR is needed. If no accident or injury occurred, you can roll the patient onto their side. This is called the recovery position. Start your first aid procedures. Monitor the patient, making sure they continue to breathe until EMS arrives. If the patient is not breathing, begin the CABs of CPR. C. Chest compressions. Start chest compressions. To make sure your hands are in the correct position, you'll need to remove clothing from the chest area of the patient. For proper hand position, Place the heel of one hand over the center of the patient's chest, on the lower half of the sternum. Be careful not to push on the lower tip of the sternum, as this is where the xiphoid process is located. If pushed hard enough, the xiphoid could possibly lacerate the liver. Next, place the other hand on top of the first hand and interlock your fingers to keep them off the patient's ribs. Compress the sternum straight down with enough force to move it at least 2 inches. Your shoulders should be straight over your hands and your elbows locked in position. You should allow your body to do the work. Release the pressure completely after each compression, allowing the chest to return to its normal position, which will allow the heart to refill with blood. The compression rate must be at least 100 compressions per minute. You should compress and release in a smooth and regular rhythm, making sure you do not bounce, rock, or bend your elbows. To perform effective chest compressions, you need to press deep, hard, and fast. Provide 30 compressions. Then, A. Open the airway. When a person lies unconscious on the ground, their muscles are very relaxed and gravity is pulling the tongue to the back of the throat, often blocking the airway. The tongue is attached to the lower jaw, so by opening the airway, you are pulling the tongue from the back of the throat. Open the airway by using a method called head tilt, chin lift. Place one hand on the patient's forehead and tilt the head back. Place the other hand on the bony part of the patient's chin and lift. By lifting the chin, you are pulling the tongue away from the back of the throat. You can tell if the airway is opened all the way by making sure the jawline is perpendicular to the ground. After opening the airway, B. Give breaths. Administer 2 full breaths. Each breath should be no longer than 1 second each. With their airway completely opened, place a CPR mask barrier over the patient's mouth. Next, pinch their nose using your hand that is on their forehead and place your mouth over their mouth, making sure you have a tight seal so no air escapes from the sides. While lifting up on the chin, give 1 breath. Take your mouth off, take a breath, and then give a second breath. While administering breaths to the patient, look out of the corner of your eye to see if the chest rises. This is how we know the breath is adequate. The compression-to-breath ratio for all ages is 30:2. Continue compressions and breaths until EMS arrives, an AED arrives, or the patient shows signs of life. When the AED arrives, immediately attach it to the patient. D. Defibrillation Aed Operation. Early defibrillation is critical to the survival of the patient. The quicker we can deliver the first shock to the patient, the greater the survival rate. An automated external defibrillator, commonly known as an AED, is a computerized device that will analyze a victim's heart rhythm and allow a rescuer to deliver a shock. These devices have audio, voice, and visual prompts to help the rescuer. AEDs may vary slightly from model to model, but most operate relatively the same. Some AEDs are fully automated. If a shock is indicated, it will direct you to stand clear as it delivers the shock.
Stand clear.
An AED can be used on all ages. Use adult pads for adults and pediatric pads for children and infants. If you do not have pediatric pads, you can use adult pads on a child or infant. However, do not use pediatric pads on adults. On children and infants, 2 minutes of CPR is recommended before attaching the AED. After you determine a person is unresponsive and not breathing, the AED can be attached to the victim. When operating the AED, place it close to the patient's head and chest, and then turn it on. Some models will turn on automatically when you open the lid. Remove all clothing from the patient's chest, including the bra. Peel the backing from the pads and place them on the patient's bare chest. Refer to the pictures on pads for correct placement. Place one pad on the upper right chest below the collarbone. Place the other pad on the lower left chest to the side, just below the nipple. If pad cables need to be attached to the AED, do so before placing the pad on the patient's chest. Stay clear of the patient while the AED analyzes their rhythm, which will take about 5 to 15 seconds. The AED will tell you if shock is indicated. If a shock is indicated, the machine will advise you to stand clear. Look to make sure everyone is clear of the patient and say, "All clear," then press the flashing button. A fully automated AED will advise you to stand clear and deliver the shock in 3 seconds. After the patient has been shocked, the AED will advise you to start CPR with chest compressions. After performing 2 minutes of CPR, which is 5 cycles of 30 compressions, followed by 2 breaths, the AED will prompt you to stand clear as it analyzes again. Continue this sequence until EMS arrives or patient shows signs of life. There will be a certain percentage of people where no shock is indicated. If the AED indicates no shock, it will tell you to start CPR with chest compressions. The AED will reanalyze every 2 minutes. While the AED is analyzing or shocking, do not touch the patient and do not remove the pads even if the victim shows signs of life. Special considerations. The following are special considerations that you must be aware of before placing pads on the patient's chest. Implanted pacemaker or defibrillator. Place the electric pad at least 1 inch away from any implanted device. These devices are underneath the skin and create a hard lump. The size is usually about 1 to 2 inches with a visible scar over it. Water. Remove the person from the water and dry the chest before attaching the pads. Medication patches. While wearing disposable gloves, remove any medication patch that is in the area of pad placement. Be sure to wipe the area clean with a gauze pad. Hairy chest. If someone is extremely hairy, you will need to shave the area where the pads are to be attached. Sweaty chest. A sweaty or wet chest needs to be dried before attaching electrode pads. Would you know what to do?
If someone was to collapse in front of you, would you know what to do?
Not really. I mean, I've had CPR training, but I don't know if I would be able to do it. I'd probably, first thing I would do would be call 911 and then, see if there's anything I could do for them.
Right.
Are you okay? Are you okay?
I feel a little pressure in my chest.
Looking a little pale, man. You okay?
I'm feel good. Getting kind of sweaty there, dude. Are you sure you feel alright?
Do you need me to call for some help?
I think I just need some fresh air.
Why don't we help him to the ground, you guys? Oh my gosh. Gabe, are you okay? Are you okay? Anthony, go call 911.
Okay.
Adam, grab the AED. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Yeah, call 911. They're on their way.
Okay, great. Thank you.
I'm gonna go outside and wait for them, okay?
Thank you.
I'll bring them in.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24.
Place one pad on their upper chest. Feel second pad and place on their lower chest as shown. Do not touch patient.
Everybody clear?
Rhythm.
I'm clear.
Do not touch patient. Analyzing rhythm. Shock advised.
Everybody clear?
Charging. Stand clear. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
Continue to perform 30 compressions followed by 2 breaths until EMS arrives, an AED arrives, or the victim shows signs of life. Once an AED arrives, immediately place it into operation. Child CPR, ages 1 to 8 years old. Fortunately, most children and infants do not go into sudden cardiac arrest. Usually, preventable injuries and respiratory problems becoming progressively worse can lead to their heart stopping, or they can be born with a congenital heart problem. Child CPR is much the same as adult CPR, however there are only a few differences. Compress 1/3 the depth of the chest, which is approximately 2 inches. You can use 1 or 2 hands to do chest compressions. If you are alone with the child or infant and no one is present to call 911, you may perform 2 minutes of CPR or about 5 cycles of compressions and breaths before calling 911 and getting the AED if it appears the child is not breathing. The following are steps of CPR for children.
Lena, wake up. Are you okay? Lena. Tori, call 911, get the AED, and come back. I'm observing for breathing. Not breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Here's the AED.
Oh, great.
911 is on its way.
Great, thank you. 3, 4, 5, 6, 7, 8, 9, 10. Good, great, thanks. 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26.
Peel 1 pad from plastic liner. Peel 1 pad from plastic liner. Peel 1 pad from plastic liner. Place 1 pad on bare upper chest. Do not touch patient.
All clear.
Analyzing rhythm.
All clear.
Do not touch patient. Analyzing rhythm. Shock advised.
Shock advised. All clear.
Starting.
All clear.
Stand clear. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient.
1, 2, 3,
Start
4,
CPR.
5.
Continue to perform 30 compressions followed by 2 breaths until EMS arrives, an AED arrives, or the victim shows signs of life. Once an AED arrives, immediately place it into operation. Obstructed airway for adults and children for ages 1 and older. In the United States, thousands of people choke to death annually. By knowing a few simple techniques, you can prevent a choking situation from being fatal. The best treatment to dislodge a blocked airway is to let the patient cough it out. A person truly choking cannot breathe, cough, cry, or speak. Most people that are choking will grab their throat. This is called the universal sign. Your immediate recognition and actions could save this person's life. Most blocked airways can be dislodged by using a technique called abdominal thrusts. Ask them, "Are you choking? Do you need help?" If no noise is coming out of their mouth and they shake their head yes, you will need to perform abdominal thrusts. When performing abdominal thrusts, you are pushing up against the diaphragm, which pushes up against the lungs, forcing the object out. To perform this technique, have the patient's back against the front of your body. Put both arms around the patient's abdomen. Locate the belly button. Place thumb side of the fist just above the belly button and place your other hand on top. Give quick inward and upward thrusts until the object has been dislodged or the patient becomes unconscious. If the patient becomes unconscious, lower patient to the ground. Place them on their back. Have someone call 911 and get an AED if this has not been done. Begin the steps of CPR. Bare the patient's chest and perform 30 compressions. After 30 compressions, look into the patient's mouth and check for object. If you see the object, remove it. If you do not see the object, do not put your fingers in the patient's mouth. Now, open the airway and attempt 2 breaths. If first breath doesn't go in, retilt airway and attempt to give a second breath. If no air goes in after 2 attempts, continue this sequence of compressions, looking for object and breaths until EMS arrives, an AED arrives, or patient shows signs of life. If a patient is pregnant or you are unable to get your arms around their middle area, perform chest thrusts instead of abdominal thrusts. Stand behind the patient, grasp around the patient's chest. The thumb side of the fist will be placed on the center of the chest on the sternum, the same place as CPR. The thrust should be straight back. If you are alone, find a table, chair, sink, or firm object and put your fist slightly above your belly button. Lean over the surface to force the object out. Anytime a patient has truly been choking, they should be seen by a doctor. Lastly, there are a few important things that you need to know if you have to perform CPR on a person. Blood-borne pathogens. Certain viruses can be carried in the blood and body fluids, such as HIV and strains of hepatitis. They are transmitted from person to person by the exchange of body fluids. It's very important that you take all precautions to protect yourself from exposure to the patient's body fluids, which includes blood, urine, saliva, vomit, feces, and other fluids. Additionally, do not touch objects that have been soiled with blood or body fluids. The areas of your body that you need to be most concerned about infection passing through are your eyes, nose, mouth, and skin that have cuts, breaks, or sores on it. The term currently used to protect the rescuer is universal precautions. The following are the universal precautions which are recommended to be used at all times. Wash hands before and after an incident. Wear disposable gloves at all times. A CPR mask barrier should be used when performing rescue breaths. Wear eye protection and gown if necessary. All body fluid spills need to be cleaned with a disinfectant. It's recommended to use a blood-borne pathogen kit, but if one is not available to you, you can use bleach and water as a disinfectant. 1/4 cup of bleach mixed in a gallon of water is usually sufficient to disinfect the area. Blood or body fluid soiled clothing should be placed in a biohazard bag. If you don't have a kit, biohazard bags or bleach, make sure EMS cleans up any spills and takes soiled items with them. Good Samaritan Law. Most states have a Good Samaritan Law. The intent of the Good Samaritan Law is to protect individuals from liability who perform CPR, first aid procedures, or utilize an AED. The law was intended so people would help other people. The law will protect you as long as you act in good faith and are not negligent. Provide treatment according to your level of training. A layperson is not obligated to render help even if you have had training. Moving accident victims. You should always avoid moving a person involved in an accident or injury, as you could cause further injury. First, check to see if the person is unresponsive and not breathing in the position found. If they are breathing, stabilize them in the position you found them in until EMS arrives. One of the exceptions of moving a person involved in an accident is if you have to move them onto a hard, flat surface to perform CPR. If you must move a patient, be sure to roll the patient while you support their head, neck, and body in a straight line so they do not twist, bend, or turn in any direction. It's best to use 2 or 3 people to do this. Positioning the patient. When you determine a patient is unresponsive and not breathing, you'll have to roll them on their back so you can perform CPR on a hard, flat surface. Do not attempt CPR with a victim lying on the bed, couch, or in the water. If an accident is involved and the patient is unresponsive but breathing, leave them in the position found. Continually monitor victim to make sure they are breathing. Start your first aid procedures. Rib fractures. If you hear or feel a rib crack, Take your hands off the patient's chest momentarily and replace in the proper position, center of the chest, lower half of the sternum. However, it is possible to break ribs even if your hands are in the correct position. Gastric distension. If you are blowing too hard and too fast when giving breaths, air can get trapped in the patient's stomach. This is called gastric distension. This will cause the patient to vomit. If the patient should vomit, roll them as a unit onto their side facing you, then sweep out the vomit. Make sure you are wearing disposable gloves. Continue CPR. If you notice the stomach getting bigger, adjust your breathing. If you're blowing too hard, don't blow as hard. If you're blowing too fast, slow down. If breaths do not fill the lungs. If the chest of the patient does not rise while performing rescue breaths, you will need to reposition the airway and open the airway again. Attempt to give a second breath. If the second breath does not fill up the lungs, immediately start chest compressions. Agonal respirations. Agonal respirations are an abnormal pattern of breathing which may appear to be an occasional gasp or snore. In this case, treat the patient as if they were not breathing and start CPR immediately. You have just learned some key guidelines essential for saving the life of a person in need. Just remember, if someone collapses, regardless if it's a heart attack, stroke, diabetic situation, asthma problem, allergic reaction, or drowning, your quick actions to initiate the steps of CPR can possibly save their life. Infant CPR, ages newborn to 1 year. The following are the steps of CPR for infants, ages newborn to 1 year. Some of the techniques are different than adult and child CPR. Scene safety. Check for unresponsiveness. You can flick the infant's foot. If unresponsive, call 911 and get the AED. Point and look directly at someone. Check breathing. Observe for breathing or agonal respirations. Check for 5 seconds. If infant is not breathing, immediately start the CABs of CPR. C. Start compressions. Bare infant's chest. Place 2 fingers on the sternum just below the nipple line. Use 2 fingers to compress the chest. Compress 1/3 the depth of the chest, approximately 1.5 inches. Compress 30 times, making sure your compressions are deep, hard, and fast. Remember to compress at a rate of at least 100 compressions per minute. After 30 compressions, A. Airway. Open the airway moderately using the head tilt chin lift method. Be careful not to overextend the neck. Then, B. Breathing. Give 2 breaths. Place your mouth over the infant's mouth and nose. With the airway completely opened, give 2 breaths, 1 second each. Make sure you have a tight seal so no air escapes from the sides. Remember, an infant is much smaller than an adult. Less air will be needed. Continue to perform 30 compressions followed by 2 breaths until EMS arrives, an AED arrives, or infant shows signs of life. Once an AED arrives, immediately place it into operation. Obstructed airway for infants newborn to 1 year. On the choking infant, a combination of back blows and chest thrusts are recommended. How will you know if an infant is choking? There will be no noise coming out of their mouth. Their eyes are wide opened and showing fear. They cannot cough or cry. When you determine the infant is choking, hold the infant and place face down on your forearm. Support the head, making sure not to block the mouth and nose. You can kneel or sit. Rest the arm holding the infant against your leg. Make sure the infant is head down. Gravity will help to draw the object out. Give 5 back blows with the heel of your other hand. The back blows will need to be in the middle of the back between the infant's shoulder blades. After 5 back blows, sandwich the infant between your forearms, making sure to support the head and neck. Turn the infant face up. Perform 5 chest thrusts, same location as CPR, same depth, but not as fast. Continue the cycles of 5 back blows and 5 chest thrusts until the object has been cleared or the infant becomes unconscious. If the infant becomes unconscious, place the infant on a table or firm surface on their back. Have someone call 911 and get the AED. Begin the steps of CPR. Provide 30 chest compressions. Then look into the infant's mouth for object. If you see the object, remove it. If you do not see the object, do not put your fingers in the infant's mouth. Regardless if the object has been removed or not, attempt to give 2 breaths. If the first breath does not go in, retilt airway and attempt to give a second breath. If no air goes in after 2 attempts, continue to perform the sequence of 30 compressions, look for object, and 2 breaths. Continue until 911 arrives, an AED arrives, or infant shows signs of life. Anytime an infant has truly been choking, they should be seen by a doctor. This concludes infant CPR and obstructed airway. Now your instructor will go over the information, answer any questions you have, and allow you the opportunity to practice the skills on a mannequin.